Question 1. Strategic planning requires a dialysis technician to meticulously assess the patient's readiness for disconnection and the subsequent care required to ensure a safe and comfortable conclusion to the dialysis session. Considering the regulatory framework for dialysis technician certifications, which of the following actions best exemplifies adherence to best professional practice during the termination of dialysis? Option A. Proceeding with needle removal as soon as the prescribed treatment time is met, assuming the patient is comfortable and no immediate issues are apparent. Option B. Disconnecting the patient's lines promptly to allow for the next patient's treatment, with minimal verbal interaction to save time. Option C. Confirming the patient's vital signs are stable, ensuring adequate hemostasis at the access site, and providing clear, reassuring communication to the patient about the disconnection process and post-dialysis care instructions. Option D. Leaving the patient immediately after needle removal to attend to other tasks, trusting that the patient will alert staff if any problems arise. The correct answer is C. Confirming the patient's vital signs are stable, ensuring adequate hemostasis at the access site, and providing clear, reassuring communication to the patient about the disconnection process and post-dialysis care instructions. Explanation. This scenario is professionally challenging because the termination of dialysis, specifically the disconnection process, involves direct patient interaction at a vulnerable moment. It requires not only technical proficiency, but also significant interpersonal skills and adherence to strict protocols to ensure patient safety and dignity. The technician must balance the immediate need to complete the procedure with the patient's physical and emotional state, all while operating within the defined scope of practice and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient well-being and safety through a systematic, patient-centered process. This involves confirming patient readiness, ensuring all safety checks are completed, and providing clear, reassuring communication. This aligns with the fundamental ethical principles of beneficence and non-maleficence, ensuring the patient is not harmed and their comfort is maximized. Regulatory frameworks for dialysis technicians, such as those governed by the Centers for Medicare and Medicaid Services, CMS, in the U.S., mandate specific procedures for patient care and safety during all phases of dialysis, including disconnection. Adherence to these guidelines is crucial for maintaining certification and ensuring quality patient care. An incorrect approach that involves rushing the disconnection without confirming the patient's comfort or vital signs is professionally unacceptable. This violates the principle of non-maleficence by potentially exposing the patient to risks such as hypotension or bleeding due to premature needle removal. It also fails to meet the regulatory requirement for vigilant patient monitoring throughout the dialysis session and its conclusion. Another incorrect approach, such as disconnecting the patient without explaining the steps or addressing their concerns, demonstrates a failure in communication and patient advocacy. This can lead to patient anxiety and distress, undermining the trust essential in the patient-caregiver relationship. Ethically, it disregards the patient's autonomy and right to be informed. Regulatory guidelines often emphasize patient education and communication as integral components of care. A third incorrect approach, which might involve leaving the patient unattended immediately after needle removal without ensuring hemostasis or observing for complications, is also professionally unacceptable. This neglects the critical post-dialysis monitoring period, during which complications like bleeding or vasovagal responses can occur. Regulatory standards require technicians to remain with or readily available to the patient until the immediate post-procedure risks have been mitigated. The professional decision-making process for similar situations should involve a clear checklist of actions, a thorough assessment of the patient's current status, and open communication. Technicians should always operate within their defined scope of practice, escalating concerns to the registered nurse when necessary, prioritizing patient safety, comfort, and dignity, while strictly adhering to established protocols and regulatory requirements, forms the bedrock of sound professional judgment. Question 2. Operational review demonstrates a recurring instance where patients experience significant discomfort during the initial saline rinse of their dialyzer due to the prescribed flow rate. The technician has observed that a slightly lower flow rate during this specific phase consistently reduces patient complaints without impacting the overall dialysis treatment duration or efficacy. What is the most appropriate course of action for the dialysis technician? Option A. Document the observation and propose a standardized adjustment to the saline rinse flow rate protocol to the clinic's Quality Improvement Committee for review and potential implementation. Option B. Immediately report the issue to the nephrologist, requesting a change in the standard protocol based solely on anecdotal patient feedback. Option C. Inform the patient that discomfort is a normal part of the procedure and proceed with the prescribed flow rate as per the established protocol. Option D. Independently adjust the saline rinse flow rate for each patient experiencing discomfort, without documenting the deviation or seeking formal approval. The correct answer is A. Document the observation and propose a standardized adjustment to the saline rinse flow rate protocol to the clinic's Quality Improvement Committee for review and potential implementation. Explanation: this scenario is professionally challenging because it requires a dialysis technician to balance immediate patient needs with established protocols and the potential for systemic process improvement. The technician must recognize that a deviation, even if seemingly beneficial in the short term, could have broader implications for patient safety, regulatory compliance, and overall clinic efficiency. Careful judgment is required to assess the root cause of the issue and determine the most appropriate course of action that aligns with best practices and regulatory mandates. The correct approach represents best professional practice because it prioritizes a systematic and documented method for addressing operational inefficiencies. By identifying the recurring issue, gathering data, and proposing a standardized solution, the technician is not only resolving an immediate problem, but also contributing to the long-term optimization of dialysis procedures. This proactive stance aligns with the ethical imperative to provide the highest quality of care and adhere to regulatory frameworks that emphasize continuous improvement and patient safety. It demonstrates a commitment to understanding the why behind a problem and implementing sustainable solutions rather than temporary fixes. An incorrect approach that involves simply bypassing the standard procedure without proper documentation or investigation is professionally unacceptable. This could lead to inconsistent care, increased risk of errors, and potential violations of regulatory guidelines that mandate adherence to established protocols for patient safety and treatment efficacy. Another incorrect approach, such as immediately escalating the issue without attempting to understand or resolve it at the technician level, might be inefficient and could undermine the technician's role in process improvement. It also fails to leverage the technician's direct experience with the operational challenge. A third incorrect approach, focusing solely on individual patient comfort without considering the broader operational impact, neglects the systemic nature of process optimization and the importance of standardized care across all patients. Professionals should use a decision-making framework that begins with identifying the problem and its potential impact. This should be followed by an assessment of current protocols and their effectiveness. If a recurring issue is observed, the next step is to investigate the root cause, gather relevant data, and consider potential solutions that align with regulatory requirements and best practices. Documenting the problem, the investigation, and the proposed solution is crucial. Collaboration with supervisors or quality improvement teams should be considered for significant or systemic issues. The ultimate goal is to implement solutions that enhance patient safety, improve efficiency, and ensure compliance. Question 3. Operational review demonstrates a dialysis technician observing a patient who reports feeling very tired and a bit dizzy during their treatment. The technician notes the patient's blood pressure is 130/80 mmHg, heart rate is 78 bpm, respiratory rate is 16 breaths per minute, and temperature is 98.6 degrees F. The patient's most recent potassium level was 4.8 mx/L, and BUN was 55 mg/dL. The patient has a history of congestive heart failure and hypertension. Which of the following actions best reflects the technician's role and responsibilities in this situation, according to U.S. federal and state regulations for dialysis technicians? Option A. Immediately stop the dialysis treatment and inform the patient that their symptoms are likely due to the dialysis process and will resolve after treatment. Option B. Focus solely on the patient's blood pressure and heart rate, as these are the most critical vital signs to monitor during dialysis, and assume the dizziness is a common side effect. Option C. Reassure the patient that their vital signs are within normal limits and continue the dialysis treatment as scheduled, advising them to report any worsening symptoms. Option D. Thoroughly review the patient's medical history, recent lab values, and current vital signs, and then report the patient's subjective complaints and objective findings to the registered nurse for further assessment and intervention. The correct answer is D. Thoroughly review the patient's medical history, recent lab values, and current vital signs, and then report the patient's subjective complaints and objective findings to the registered nurse for further assessment and intervention. Explanation. Scenario analysis. This scenario presents a common challenge in dialysis care, where a patient's subjective report of feeling unwell conflicts with seemingly stable objective vital signs. The professional challenge lies in discerning the true clinical significance of the patient's complaint, balancing the need for prompt intervention with the risk of unnecessary alarm or disruption to the dialysis schedule. Accurate interpretation of vital signs, understanding of typical lab value ranges in dialysis patients, and thorough consideration of the patient's medical history are paramount to making a sound clinical judgment. Correct approach analysis. The correct approach prioritizes a comprehensive assessment that integrates the patient's subjective report with objective data and historical context. This aligns with best professional practice as mandated by regulatory frameworks governing dialysis technician responsibilities, which emphasize patient-centered care and the technician's role in identifying and reporting potential changes in patient status. Specifically, regulatory guidelines for dialysis technician certifications, assuming U.S. federal regulations like those from CMS and state-specific licensing boards, require technicians to monitor patients, recognize deviations from baseline, and report these to the registered nurse. A thorough review of vital signs, recent lab values e.g., potassium, BUN, creatinine, hemoglobin, and the patient's known medical history e.g., cardiac conditions, fluid overload history, recent medication changes, provides the necessary data to assess the significance of the patient's complaint. This holistic approach ensures that potential complications are not overlooked and that appropriate interventions are initiated in a timely manner, thereby upholding patient safety and quality of care. Incorrect approach is analysis. One incorrect approach would be to dismiss the patient's complaint solely because their vital signs appear within normal limits. This fails to acknowledge that vital signs can be lagging indicators of distress, and that a patient's subjective experience is a critical component of their overall assessment. Regulatory failure here lies in neglecting the requirement to investigate patient-reported symptoms, potentially leading to delayed diagnosis and treatment of emergent conditions. Another incorrect approach would be to immediately initiate a drastic intervention, such as stopping the dialysis treatment, without a more thorough assessment. While vigilance is important, acting solely on a subjective complaint without correlating it with objective data and medical history can lead to unnecessary treatment interruptions, patient anxiety, and potential adverse effects from premature discontinuation of dialysis. This approach demonstrates a failure to apply critical thinking and a lack of adherence to established protocols for patient assessment and management. A third incorrect approach would be to focus only on the most recent lab values without considering trends or the patient's current clinical presentation. Lab values provide a snapshot, but their interpretation must be contextualized by the patient's immediate condition and historical data. Ignoring the patient's subjective report and focusing narrowly on isolated lab data can lead to misinterpretations and missed opportunities for early intervention. Professional reasoning. Professionals should employ a systematic approach to patient assessment. This involves actively listening to the patient's concerns, forming a thorough review of objective data, vital signs, physical assessment findings, and integrating this with the patient's medical history and recent laboratory results. When a discrepancy arises between subjective and objective findings, further investigation and communication with the registered nurse are essential. This decision-making process is guided by regulatory requirements for patient monitoring, reporting, and the ethical imperative to provide safe and effective care. Question 4. Quality control measures reveal that the conductivity of the dialysate is intermittently exceeding the acceptable limit, suggesting a potential issue with the water treatment system. The facility's reverse osmosis (RO) unit is functioning, and the deionization dye tanks have recently been replaced. What is the most appropriate immediate course of action to address this conductivity issue? Option A. Increase the frequency of dialysate conductivity checks to monitor the trend, assuming the recent dye resin replacement will eventually stabilize the readings. Option B. Conduct a comprehensive diagnostic assessment of the RO membrane integrity and performance, and verify the effectiveness of the newly installed dye resin through conductivity testing of the treated water post dye. Option C. Focus solely on recalibrating the conductivity meter, as intermittent readings can often be attributed to equipment malfunction rather than system failure. Option D. Immediately replace the RO membrane, as it is the primary component responsible for removing dissolved ions, and the dye resin may have been prematurely exhausted due to RO failure. The correct answer is B. Conduct a comprehensive diagnostic assessment of the RO membrane integrity and performance, and verify the effectiveness of the newly installed dye resin through conductivity testing of the treated water post dye. Explanation. Scenario analysis. This scenario presents a common yet critical implementation challenge in dialysis facilities, ensuring the consistent efficacy of water treatment systems, specifically reverse osmosis RO and deionization dye, which are vital for patient safety. The challenge lies in identifying the root cause of a quality control deviation and implementing the correct corrective action promptly and effectively, adhering strictly to established protocols and regulatory requirements. Failure to do so can lead to patient harm due to dialysate contamination. Correct approach analysis. The correct approach involves a systematic, multifaceted investigation that begins with verifying the integrity of the RO membrane and the dye resin. This aligns with best professional practice because it directly addresses the primary components responsible for water purification. Regulatory frameworks for dialysis facilities, such as those established by the Centers for Medicare and Medicaid Services, CMS, in the U.S., mandate rigorous monitoring and maintenance of water treatment systems. This approach ensures that the system is functioning within acceptable parameters, as defined by standards like the Association for the Advancement of Medical Instrumentation (AMI) RD52, which specifies limits for contaminants and performance criteria for RO and dye units. Verifying the RO membrane's integrity, e.g., checking for leaks or bypass, and assessing the dye resin's capacity, e.g., conductivity testing, are fundamental steps in troubleshooting water quality issues. This methodical approach minimizes the risk of overlooking a critical failure point and ensures that corrective actions are targeted and effective, thereby upholding patient safety and regulatory compliance. Incorrect approaches analysis. One incorrect approach is to immediately replace the dye resin without a thorough assessment of the RO system. This is a regulatory and ethical failure because it bypasses essential diagnostic steps. The RO system is the first line of defense in water purification. If it is compromised, the dye system will be quickly exhausted, leading to a false conclusion that the dye resin is the sole problem. This can result in unnecessary costs and prolonged periods of potentially suboptimal water quality. Another incorrect approach is to rely solely on visual inspection of the RO unit without performing functional tests or checking monitoring logs. This is a failure to adhere to established quality control protocols. Regulatory guidelines require objective, quantifiable data to confirm system performance, not just subjective observations. Furthermore, ignoring the conductivity readings from the dye unit and assuming the issue is with the RO system alone is also a failure. Each component of the water treatment system has specific monitoring requirements, and neglecting any part of the diagnostic process can lead to an incomplete or inaccurate resolution, potentially exposing patients to harmful contaminants. Professional reasoning. Professionals facing such a challenge should employ a structured problem-solving methodology. This involves 1. Acknowledging the deviation and its potential impact on patient safety. 2. Consulting relevant facility policies and procedures, as well as applicable regulatory standards, e.g., CMS AMI. 3. Initiating a systematic diagnostic process that evaluates each component of the water treatment system in sequence, starting with the RO and then the dye. 4. Utilizing available monitoring data and performing necessary functional tests to identify the root cause. 5. Implementing corrective actions based on the identified root cause, followed by retesting to confirm resolution. 6. Documenting all findings, actions, and retest results meticulously. This systematic approach ensures that decisions are evidence-based, compliant with regulations, and prioritize patient well-being. Question 5. The evaluation methodology shows a patient presenting for dialysis. The technician observes the patient has a surgically placed catheter in their abdomen. Based on this observation alone, Which of the following is the most appropriate initial action for the dialysis technician to take regarding the patient's dialysis modality? Option A. Assume the patient is undergoing peritoneal dialysis and prepare the appropriate supplies. Option B. Proceed with setting up standard hemodialysis equipment, as it is more common. Option C. Confirm the prescribed dialysis modality by reviewing the patient's chart and physician's orders. Option D. Inquire from the patient if they are receiving peritoneal dialysis. Correct answer is C. Confirm the prescribed dialysis modality by reviewing the patient's chart and physician's orders. Explanation. The evaluation methodology shows a scenario where a dialysis technician must differentiate between hemodialysis and peritoneal dialysis based on patient presentation and prescribed treatment. This is professionally challenging because misidentification could lead to incorrect equipment selection, improper procedure initiation, and potentially severe patient harm, directly violating patient safety protocols and regulatory standards for dialysis care. The technician's role requires a thorough understanding of the distinct principles, equipment, and patient care requirements of each modality. The correct approach represents best professional practice because it involves a systematic assessment of the patient's current treatment modality, confirmed by reviewing the patient's chart and physician's orders. This aligns with regulatory frameworks that mandate accurate patient identification and adherence to prescribed treatment plans to ensure patient safety and efficacy of care. Specifically, it upholds standards of care that require technicians to operate within their scope of practice and follow physician directives precisely. An incorrect approach of assuming the modality based solely on the patient's physical appearance or a general understanding of common dialysis types is a significant regulatory and ethical failure. It bypasses the critical step of verifying the prescribed treatment, which is a cornerstone of patient safety and regulatory compliance. This could lead to administering the wrong type of dialysis, potentially causing life-threatening complications such as infection, fluid imbalance, or electrolyte disturbances, all of which are violations of patient care standards and could result in disciplinary action. Another incorrect approach of proceeding with a treatment without clear physician orders or confirmation of the modality constitutes practicing outside of established protocols and could be construed as negligence. This directly contravenes regulations that require all medical procedures to be authorized and documented. The professional reasoning process for similar situations should involve a multi-step verification. First, always consult the patient's electronic health record or chart for the most current physician's orders regarding the dialysis modality. Second, if there is any ambiguity or if the patient is new to the unit, verbally confirm the prescribed modality with a registered nurse or the physician. Third, ensure all equipment and supplies are specific to the confirmed modality before initiating treatment. This layered approach minimizes the risk of error and ensures adherence to regulatory requirements for safe and effective patient care. Question 6. Risk assessment procedures indicate that a dialysis technician observes significant swelling around the venous anastomosis of a patient's arteriovenous (AV) fistula prior to initiating the dialysis treatment. The technician has no prior knowledge of this swelling. What is the most appropriate immediate course of action? Option A. Apply a tourniquet proximal to the AV fistula to reduce the swelling before cannulation. Option B. Attempt to palpate the fistula to assess for a thrill and bruit, and then proceed if normal. Option C. Immediately notify the nephrologist or physician responsible for the patient's care. Option D. Proceed with dialysis as scheduled, but monitor the swelling closely during the treatment. Correct answer is C. Immediately notify the nephrologist or physician responsible for the patient's care. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a dialysis technician to make a critical judgment call regarding patient safety and the integrity of a dialysis access site. The technician must balance the immediate need for dialysis with the potential risks associated with a compromised access. This requires a thorough understanding of different access types, their associated complications, and the established protocols for managing such situations. The technician's decision directly impacts patient well-being, treatment efficacy, and adherence to regulatory standards. Correct approach analysis. The correct approach involves immediate notification of the nephrologist or physician responsible for the patient's care. This aligns with best professional practice and regulatory guidelines for dialysis technicians. Regulatory frameworks for dialysis technicians emphasize the importance of reporting any deviations from the patient's normal condition or any concerns regarding access integrity to the supervising physician. This ensures that a qualified medical professional can assess the situation, determine the cause of the swelling, and implement the appropriate course of action, which might include further diagnostic tests, adjustments to the dialysis prescription, or even temporary cessation of dialysis. This proactive communication is crucial for patient safety and prevents potential complications such as infection, thrombosis, or hemorrhage. Incorrect approach is analysis. Proceeding with dialysis without notifying the physician is a significant regulatory and ethical failure. It bypasses the established chain of command and deprives the physician of critical information needed to manage the patient's care. This could lead to exacerbation of the underlying issue causing the swelling, potentially resulting in serious harm to the patient. It violates the principle of patient safety and demonstrates a lack of adherence to professional responsibilities. Attempting to palpate the fistula to assess for a thrill without prior physician consultation is also problematic. While palpation is a standard assessment technique, doing so in the presence of unusual swelling without informing the physician could delay necessary medical intervention. The swelling itself is a sign that something is amiss, and further manipulation without a physician's assessment could potentially worsen the condition or mask symptoms. This approach prioritizes a diagnostic step over immediate reporting of a concerning symptom. Applying a tourniquet above the access site to reduce swelling before dialysis is a direct intervention that should only be performed under physician orders. This action could potentially impede blood flow, cause discomfort or pain to the patient, or even lead to complications like thrombosis if not managed correctly. It represents an unauthorized medical intervention and a failure to follow the proper reporting and decision-making protocols. Professional reasoning. Professionals in this situation should follow a clear decision-making process. 1. Recognize the deviation from the norm, swelling. 2. Immediately cease any planned interventions that could be affected by the deviation. 3. Report the observation and concern to the supervising physician or nephrologist. 4. Await further instructions and collaborate with the medical team. This process prioritizes patient safety, adherence to regulatory requirements, and the collaborative nature of healthcare. Question 7. The risk matrix shows a moderate likelihood of minor equipment malfunctions during routine dialysis treatments, but a high impact on patient safety if critical alarms are ignored. A dialysis technician notices a recurring, low-level pressure fluctuation alarm on a patient's dialysis machine that has not been previously documented. The technician has performed this procedure many times and believes it might be a minor sensor issue that could be resolved by a quick reset, potentially saving time before the next patient arrives. What is the most appropriate course of action for the dialysis technician? Option A. Ignore the alarm as it is a low-level fluctuation and has not caused any apparent distress to the patient. Option B. Continue the dialysis treatment while monitoring the patient closely, but do not take any immediate action regarding the alarm until the treatment is complete. Option C. Perform a quick reset of the alarm, assuming it is a minor sensor issue, and continue with the dialysis treatment to avoid delaying the next patient. Option D. Immediately consult the dialysis machine's operating manual and the facility's policy and procedure manual for guidance on alarm troubleshooting, and if necessary, escalate the issue to a supervisor or biomedical engineering before proceeding with any intervention or continuing the treatment. The correct answer is D. Immediately consult the dialysis machine's operating manual and the facility's policy and procedure manual for guidance on alarm troubleshooting, and if necessary, escalate the issue to a supervisor or biomedical engineering before proceeding with any intervention or continuing the treatment. Explanation. This scenario presents a professional challenge due to the critical nature of patient safety in dialysis care and the potential for serious harm if protocols are not strictly followed. The technician is faced with a situation where a deviation from standard procedure, even if seemingly minor, could have significant consequences. Careful judgment is required to balance efficiency with patient well-being and regulatory compliance. The correct approach represents best professional practice because it prioritizes patient safety and adheres to established protocols, which are designed to prevent adverse events. Following the manufacturer's instructions for the dialysis machine and the facility's established policies ensures that the equipment is functioning optimally, and that the patient receives safe and effective treatment. This aligns with the core ethical principles of beneficence and non-maleficence, as well as the regulatory requirement to provide care according to approved standards. An incorrect approach that involves bypassing a safety check to save time is professionally unacceptable. This action directly violates the principle of non-maleficence by introducing an unnecessary risk to the patient. It also represents a failure to adhere to regulatory requirements for equipment operation and patient care, potentially leading to disciplinary action, patient harm, and legal liability. Another incorrect approach, such as proceeding with the treatment without fully understanding the alarm's meaning, demonstrates a lack of professional diligence and a disregard for patient safety. This could result in misinterpreting a critical warning, leading to incorrect interventions or a failure to address a serious issue, thereby violating the duty of care owed to the patient. A further incorrect approach, such as assuming the alarm is a false positive without proper investigation, is also professionally unacceptable. This demonstrates a failure to follow a systematic problem-solving process and a potential overconfidence that can lead to overlooking genuine equipment malfunctions or patient distress. It undermines the integrity of the treatment process and compromises patient safety. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge the alarm or deviation from protocol. 2. Consult relevant resources, manufacturer's manual, facility policy, supervisor, to understand the issue. 3. Prioritize patient safety above all else. 4. Take appropriate action based on established protocols and professional judgment. 5. Document all actions taken and observations. 6. Communicate any concerns or issues to the appropriate personnel. Question 8. Benchmark analysis indicates that a dialysis technician is responsible for preparing reusable equipment for sterilization. The technician observes that the standard sterilization cycle for a particular instrument takes longer than a cycle used in a previous facility where they worked. The technician considers initiating a slightly modified, shorter cycle that they believe will achieve the same level of cleanliness based on their prior experience to improve workflow efficiency. Which of the following actions best aligns with regulatory requirements for infection control equipment and sterilization methods? Option A. Initiate the modified, shorter sterilization cycle, as the technician's experience suggests it is effective and will improve efficiency. Option B. Use a different, readily available disinfectant for pre-cleaning the equipment, as it appears to be a strong disinfectant and is more convenient. Option C. Rely on the judgment of a senior technician who has been with the facility for many years to determine if the shorter cycle is acceptable. Option D. Consult the manufacturer's validated instructions for the specific sterilization equipment and instrument, and adhere strictly to the recommended cycle parameters. Correct answer is A. Initiate the modified, shorter sterilization cycle, as the technician's experience suggests it is effective and will improve efficiency. Explanation. Scenario analysis. This scenario presents a common challenge in dialysis settings, ensuring the consistent and correct application of infection control protocols, specifically concerning the handling of sterilization equipment. The technician must balance efficiency with absolute adherence to safety standards to prevent patient harm and facility noncompliance. The challenge lies in recognizing subtle deviations from established procedures that, while seemingly minor, can have significant consequences for patient safety and regulatory standing. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by strictly adhering to the manufacturer's validated sterilization instructions for the specific equipment. This aligns with the core principles of infection control mandated by regulatory bodies governing dialysis technician certifications. These regulations emphasize that sterilization processes must be validated and consistently followed to ensure the inactivation of all microorganisms. Deviating from manufacturer instructions, even with perceived improvements in efficiency, bypasses the validation process and introduces an unacceptable risk of incomplete sterilization, leading to potential patient infections and severe regulatory penalties. This approach represents best professional practice because it is evidence-based, patient-centered, and directly supports the facility's commitment to providing safe and effective care as outlined in regulatory guidelines. Incorrect approaches analysis. Implementing a faster sterilization cycle without revalidation by the manufacturer is a direct violation of regulatory requirements. Sterilization cycles are validated for specific parameters: time, temperature, pressure, chemical concentration, to achieve a defined level of microbial inactivation. Altering these parameters without revalidation negates the assurance of sterility and creates a significant risk of transmitting infectious agents to vulnerable patients. This constitutes a serious regulatory failure and an ethical breach of the duty of care. Using a different, unapproved disinfectant for cleaning reusable equipment before sterilization, even if it appears to be effective, is also a critical failure. Disinfectants must be approved for use in healthcare settings and specifically for the type of equipment being cleaned. Unapproved disinfectants may not be effective against all pathogens, could damage the equipment, or leave residues that interfere with the sterilization process. This bypasses established safety protocols and introduces an unknown level of risk, violating regulatory mandates for the use of approved agents. Relying on anecdotal evidence or the experience of a senior technician to determine the adequacy of sterilization, rather than following established protocols and manufacturer guidelines, is a dangerous practice. While experience is valuable, it cannot replace the scientific validation and documented procedures required for sterilization. This approach ignores the objective, evidence-based requirements of regulatory bodies and opens the door to subjective and potentially unsafe practices, leading to non-compliance and patient harm. Professional reasoning. Professionals in dialysis settings must adopt a decision-making process rooted in a thorough understanding of regulatory frameworks, manufacturer guidelines, and established infection control principles. When faced with a situation involving equipment handling and sterilization, the primary consideration must always be patient safety. This involves 1. Consulting and strictly adhering to the manufacturer's validated instructions for all equipment, including sterilization procedures. 2. Verifying that all cleaning agents and disinfectants are approved for healthcare use and specifically for the equipment in question. 3. Understanding that any deviation from validated protocols requires formal revalidation and approval by the appropriate authorities or manufacturers. 4. Prioritizing regulatory compliance and patient well-being over perceived efficiency gains or anecdotal recommendations. 5. Actively participating in ongoing training and staying updated on current infection control, best practices, and regulatory updates. In essence, the professional decision-making process should be one of diligent adherence to established, validated protocols, with any proposed changes subjected to rigorous review and revalidation before implementation. Question 9. Quality control measures reveal that a dialysis technician has observed a patient exhibiting signs of fluid overload, such as edema and shortness of breath, during their dialysis session. The patient, however, insists they have been strictly following their prescribed low-sodium diet and fluid restrictions. The technician also notes that the patient's pre-dialysis weight is significantly higher than expected based on their dry weight. What is the most appropriate course of action for the dialysis technician in this situation? Option A. Advise the patient that they are likely not adhering to their diet and instruct them to significantly reduce their fluid intake immediately, regardless of the prescribed restrictions. Option B. Ignore the patient's claims of dietary adherence and the observed clinical signs, as the technician's role is limited to operating the dialysis machine and not assessing patient compliance or health status. Option C. Document the observed signs of fluid overload and the patient's statement regarding dietary adherence, and immediately report these findings to the registered nurse and the registered dietitian for further assessment and intervention. Option D. Assume the patient is not being truthful about their diet and focus solely on managing the fluid overload through dialysis adjustments, without further discussion with the patient or other team members. Correct answer is C. Document the observed signs of fluid overload and the patient's statement regarding dietary adherence, and immediately report these findings to the registered nurse and the registered dietitian for further assessment and intervention. Explanation. Scenario analysis. This scenario presents a common challenge in dialysis care where a patient's dietary intake directly impacts their treatment outcomes and overall well-being. The technician is faced with conflicting information: the patient's subjective report of adherence versus objective clinical indicators of potential nutritional issues. This requires careful observation, communication, and understanding of the interplay between diet, dialysis, and patient health, all within the established regulatory framework for dialysis technicians. Correct approach analysis. The correct approach involves a multifaceted response that prioritizes patient safety and adherence to established protocols. It requires the technician to document the observed discrepancy, communicate it to the appropriate healthcare professional, the nurse or dietitian, and reinforce the importance of the prescribed diet. This aligns with regulatory guidelines that mandate accurate patient monitoring, clear communication within the healthcare team, and patient education. The technician's role is to identify potential problems and escalate them, not to diagnose or independently alter treatment plans. This approach ensures that the patient receives comprehensive care based on the expertise of the entire dialysis team. Incorrect approach is analysis. One incorrect approach involves dismissing the patient's subjective report and solely relying on the observed clinical signs. This fails to acknowledge the patient's perspective and could lead to missed opportunities for understanding adherence barriers. It also bypasses the crucial step of communicating observations to the nursing or dietetic staff, potentially delaying necessary interventions. Another incorrect approach is to directly advise the patient to alter their diet without consulting the physician or dietitian. This is a significant regulatory and ethical failure. Dialysis technicians are not authorized to provide medical or nutritional advice or to modify prescribed dietary plans. Such actions could lead to serious health consequences for the patient and violate scope of practice regulations. A third incorrect approach is to ignore the discrepancy altogether, assuming the patient is compliant or that the clinical signs are unrelated. This represents a failure in patient monitoring and reporting, which are fundamental responsibilities of a dialysis technician. It could allow a potentially serious nutritional issue to go unaddressed, impacting the patient's health and dialysis effectiveness. Professional reasoning. When faced with a discrepancy between a patient's reported adherence and clinical observations, a dialysis technician should follow a structured decision-making process. First, meticulously document all observations, including the patient's statements and any physical signs. Second, communicate these findings promptly and clearly to the registered nurse or the registered dietitian. Third, reinforce the importance of the prescribed dietary regimen with the patient, encouraging them to discuss any challenges they face with the healthcare team. This systematic approach ensures patient safety, promotes interdisciplinary collaboration, and upholds regulatory standards. Question 10. The efficiency study reveals that certain routine equipment monitoring procedures, including blood pressure checks and scale readings, could potentially be extended in duration between assessments without a statistically significant increase in adverse events in a controlled environment. Considering the absolute priority of patient safety and the regulatory framework governing dialysis technician certifications, which of the following represents the most appropriate course of action for a dialysis technician when presented with these findings? Option A. Review the efficiency study's methodology and findings in conjunction with current regulatory guidelines and established best practices for patient monitoring, and propose modifications to existing protocols only if they demonstrably enhance patient safety and maintain or improve the quality of care without compromising regulatory compliance. Option B. Implement the suggested extended monitoring intervals for blood pressure and scale readings to improve operational efficiency, provided the automated alarms on the dialysis machines are functioning correctly. Option C. Reduce the frequency of manual blood pressure checks and scale readings to align with the efficiency study's recommendations, while increasing the reliance on the dialysis machines' built-in alarm systems to alert to critical changes. Option D. Immediately adopt the extended monitoring intervals for blood pressure and scale readings as recommended by the efficiency study, as it is designed to optimize workflow. The correct answer is B. Implement the suggested extended monitoring intervals for blood pressure and scale readings to improve operational efficiency, provided the automated alarms on the dialysis machines are functioning correctly. Explanation. Scenario analysis. This scenario presents a common challenge in dialysis settings, balancing the need for efficient patient care with the absolute imperative of patient safety. The efficiency study highlights a potential conflict between streamlining processes and maintaining vigilant monitoring of critical patient parameters. The professional challenge lies in interpreting the study's findings and determining how to integrate them into daily practice without compromising the established standards of care, particularly concerning the monitoring of vital signs and equipment functionality. This requires a nuanced understanding of both operational efficiency and patient well-being, recognizing that deviations from standard monitoring protocols, even for perceived efficiency gains, can have serious consequences. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by ensuring that any proposed efficiency improvements do not diminish the frequency or thoroughness of essential equipment monitoring. This aligns with the core principles of dialysis technician certification, which emphasize patient well-being and adherence to established protocols for monitoring vital signs and equipment alarms. Regulatory frameworks for dialysis technicians typically mandate specific monitoring frequencies and alarm response procedures to prevent adverse events. Therefore, integrating efficiency measures must be done in a way that reinforces, rather than replaces, these critical safety checks, ensuring that blood pressure, weight, and alarm systems are consistently and accurately assessed. Incorrect approaches analysis. One incorrect approach involves reducing the frequency of blood pressure monitoring based on the efficiency study's suggestion of longer intervals between checks. This directly violates established patient care standards and regulatory requirements that often specify more frequent monitoring, especially during dialysis, to detect rapid fluid shifts or hemodynamic instability. Another incorrect approach is to rely solely on automated alarm systems without manual verification of their functionality or the patient's physiological response. While alarms are crucial, they are supplementary to direct observation and assessment by a trained technician. Failure to manually check equipment and patient status can lead to missed critical changes that an alarm might not detect or might trigger too late. A third incorrect approach is to interpret the efficiency study as a directive to bypass routine scale measurements, assuming weight changes are less critical than other vital signs. This is a significant ethical and regulatory failure, as accurate weight monitoring is fundamental to managing fluid balance in dialysis patients and preventing complications like pulmonary edema or hypertension. Professional reasoning. Professionals should approach such efficiency studies with a critical lens, always prioritizing patient safety and regulatory compliance. The decision-making process should involve 1. Understanding the specific regulatory mandates for patient monitoring and equipment checks. 2. Evaluating any proposed efficiency measure against these mandates and the potential impact on patient safety. 3. Consulting with supervisors and clinical leadership to ensure any changes are evidence-based and approved. 4. Prioritizing patient well-being above perceived operational gains, recognizing that deviations from established safety protocols are unacceptable. Question 11. Assessment of a dialysis technician's response when a dialysis machine alarm sounds, indicating a potential air embolism, and the patient is still connected to the circuit. The technician observes air bubbles in the venous line. What is the most appropriate immediate course of action? Option A. Disconnect the patient from the dialysis machine and initiate emergency medical services. Option B. Continue the dialysis treatment while observing the patient for any signs of distress. Option C. Immediately clamp the venous line, stop the blood pump, and alert the registered nurse. Option D. Attempt to manually remove the air bubbles from the venous line before alerting the nurse. The correct answer is C. Immediately clamp the venous line, stop the blood pump, and alert the registered nurse. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in dialysis care, a machine alarm indicating a potential air embolism. The immediate concern is patient safety, as an air embolism can have severe and life-threatening consequences. The technician must act swiftly and decisively, balancing the need for rapid intervention with adherence to established protocols to ensure the patient's well-being and the integrity of the dialysis treatment. The pressure to resolve the alarm quickly, coupled with the potential for serious harm, makes this situation professionally demanding, requiring a calm, systematic, and informed approach. Correct approach analysis. The correct approach prioritizes immediate patient safety by stopping the infusion of air and initiating measures to prevent further air from entering the patient's bloodstream. This aligns directly with the fundamental ethical and regulatory obligation of a dialysis technician to protect patient welfare. Protocols for air embolism management are universally established in dialysis settings and are designed to mitigate immediate risk. Promptly notifying the nursing staff is crucial as they are responsible for the overall patient assessment and management, including administering any necessary medical interventions. Following established emergency protocols ensures a standardized and effective response, minimizing the potential for error and maximizing the chances of a positive patient outcome. This approach reflects best professional practice by adhering to safety-first principles and established clinical guidelines. Incorrect approaches analysis. One incorrect approach involves continuing the dialysis treatment while attempting to troubleshoot the alarm. This is a grave regulatory and ethical failure. The primary duty of a dialysis technician is patient safety. Continuing treatment in the face of an air embolism alarm directly contravenes this duty, as it allows a potentially lethal condition to progress. This action would violate regulations mandating patient safety protocols and could lead to severe patient harm, resulting in disciplinary action and legal repercussions. Another incorrect approach is to ignore the alarm and wait for the patient to report symptoms. This is a critical failure in vigilance and adherence to safety protocols. Dialysis machines are equipped with alarms specifically to detect and alert technicians to potentially dangerous situations before they manifest severe symptoms. Ignoring an alarm is a dereliction of duty and a direct violation of the technician's responsibility to monitor the patient and the equipment. This inaction could have catastrophic consequences for the patient and represents a significant breach of professional standards and regulatory requirements. A third incorrect approach is to attempt complex repairs or adjustments to the machine without proper training or authorization, while the patient is still connected and the alarm is active. While troubleshooting is part of maintenance, attempting advanced repairs under emergency conditions without following established protocols or involving appropriate personnel, like biomedical engineering or a supervisor, can exacerbate the problem or delay life-saving interventions. This could lead to further equipment malfunction, compromise patient safety, and violate protocols regarding equipment maintenance and emergency response. It demonstrates a lack of understanding of the hierarchy of response and the importance of involving the correct resources in an emergency. Professional reasoning. Professionals facing this situation should employ a decision-making process that begins with immediate threat assessment and prioritization of patient safety. The first step is always to stop the immediate danger, e.g., stop the infusion of air. This should be followed by activating established emergency protocols, which typically involve notifying the registered nurse immediately. The technician's role is to execute the initial safety steps and alert the clinical team, not to independently manage a complex medical emergency. Understanding the limitations of one's role and the importance of interdisciplinary communication and adherence to established protocols are paramount for effective and safe patient care. Question 12. Comparative studies suggest that while patient self-reporting is valuable, a comprehensive post-dialysis assessment by a trained technician is critical for early detection of complications. Following a routine hemodialysis treatment, a patient reports feeling a bit tired, but otherwise states they are fine. What is the most appropriate immediate course of action for the dialysis technician? Adhering strictly to U.S. regulatory frameworks for dialysis technicians. Option A. Accept the patient's statement of feeling a bit tired and assist them in preparing for discharge, assuming this is a normal post-dialysis fatigue. Option B. Immediately reassess the patient's fluid status and electrolyte balance, as fatigue is a common indicator of these issues. Option C. Perform a full set of vital signs. Assess the access site for bleeding or hematoma, and inquire about any specific discomfort or unusual sensations before allowing the patient to ambulate independently. Option D. Document the patient's subjective report of fatigue and advise them to rest at home, suggesting they contact their physician if symptoms worsen. The correct answer is C. Perform a full set of vital signs, assess the access site for bleeding or hematoma, and inquire about any specific discomfort or unusual sensations before allowing the patient to ambulate independently. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dialysis technician to balance immediate patient comfort and safety with the long-term implications of post-dialysis recovery. Patients may experience a range of symptoms after treatment, and distinguishing between normal physiological responses and early signs of complications necessitates keen observation and understanding of individual patient histories. The technician must act decisively, yet cautiously, adhering strictly to established protocols to ensure patient well-being and prevent adverse outcomes. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based assessment of the patient's post-dialysis status. This aligns with the core principles of patient care mandated by regulatory frameworks for dialysis technicians, which emphasize vigilant monitoring and prompt intervention. Specifically, it reflects the requirement to assess vital signs, observe for signs of fluid overload or hypovolemia, and evaluate the access site for any bleeding or infection. This comprehensive evaluation ensures that any deviations from the patient's baseline are identified early, allowing for timely reporting to the nursing staff or physician, thereby preventing potential complications from escalating. This proactive stance is a cornerstone of safe and effective dialysis care. Incorrect approach is analysis. One incorrect approach involves solely focusing on the patient's subjective report of feeling tired without conducting a thorough physical assessment. This fails to meet regulatory requirements for comprehensive post-dialysis monitoring. Patients may not accurately articulate their symptoms, or their fatigue could be a symptom of a more serious underlying issue, such as hypotension or a clotting event. Relying solely on subjective feedback without objective data is a significant ethical and regulatory failure, potentially leading to misdiagnoses and adverse patient outcomes. Another incorrect approach is to immediately discontinue monitoring once the patient states they feel fine, assuming a complete recovery. This disregards the potential for delayed complications that can manifest after the immediate post-dialysis period. Regulatory guidelines for dialysis technicians mandate a period of observation to ensure stability. Prematurely ending this observation period is a breach of protocol and an ethical lapse, as it compromises patient safety by not accounting for the possibility of post-dialysis complications like cramping, nausea, or even more severe events. A third incorrect approach is to attribute all post-dialysis symptoms, such as dizziness or nausea, solely to the patient's underlying condition without further investigation. While these symptoms can be related to chronic kidney disease, they can also be indicative of acute post-dialysis complications like hypotension or electrolyte imbalances. Regulatory frameworks require technicians to assess for and report signs of acute complication, not to make assumptions that could delay necessary medical intervention. This approach represents a failure to adhere to the standard of care and a potential violation of patient safety regulations. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's pre-dialysis status and expected post-dialysis recovery. This involves reviewing the patient's chart, understanding their individual treatment plan, and being aware of their typical post-dialysis responses. Upon completion of dialysis, the technician must initiate a standardized post-dialysis assessment protocol, which includes checking vital signs, assessing the access site, and observing for general well-being. Crucially, this assessment must be both objective, e.g., blood pressure, pulse, visual inspection, and subjective, e.g., asking about comfort, pain, or any unusual sensations. Any findings that deviate from the patient's baseline or suggest a potential complication must be immediately escalated to the appropriate licensed healthcare professional, following established facility protocols. This systematic, evidence-based approach ensures that patient safety is paramount and that all regulatory and ethical obligations are met. Question 13. The control framework reveals that a dialysis technician is monitoring a patient undergoing hemodialysis. The patient begins to report severe cramping in their legs, and simultaneously, the venous pressure alarm sounds, indicating a potential issue within the extracorporeal circuit. What is the most appropriate immediate course of action for the technician to manage these concurrent complications? Option A. Increase the blood flow rate to try and compensate for any potential clotting and administer a pain reliever for the cramping. Option B. Administer a bolus of intravenous fluid and continue the dialysis treatment at the current blood flow rate while observing the patient. Option C. Ask the patient to try to relax their muscles and wait for the physician to arrive before taking any action. Option D. Immediately reduce the blood flow rate. Assess the patient for signs of hypotension and examine the extracorporeal circuit for visible clotting. The correct answer is D. Immediately reduce the blood flow rate, assess the patient for signs of hypotension, and examine the extracorporeal circuit for visible clotting. Explanation. This scenario is professionally challenging because managing complications during dialysis requires immediate, accurate, and evidence-based interventions to ensure patient safety and treatment efficacy. Hypotension, cramping, and clotting are common but potentially serious issues that can rapidly escalate if not addressed appropriately, impacting patient well-being and potentially leading to adverse outcomes. Careful judgment is required to differentiate between minor discomfort and emergent situations, and to implement interventions that are both effective and compliant with established protocols. The correct approach represents best professional practice because it prioritizes patient assessment, adherence to established protocols, and clear communication. Promptly assessing vital signs and patient symptoms allows for accurate identification of the complication. Following established protocols for managing hypotension, such as reducing the blood flow rate and administering saline, is crucial for stabilizing the patient and preventing further decline. Similarly, addressing cramping with saline administration and potentially reducing the dialysate temperature aligns with best practices. Recognizing and addressing clotting in the extracorporeal circuit is vital to prevent blood loss and ensure the adequacy of the dialysis treatment. Documenting all interventions and patient responses is a regulatory requirement and essential for continuity of care and legal protection. An incorrect approach of delaying intervention or relying solely on patient self-reporting without objective assessment fails to meet the standard of care. This could lead to a worsening of the patient's condition, potentially resulting in severe hypotension, significant blood loss from a clotted circuit, or prolonged discomfort from cramping, all of which could be considered negligence. Another incorrect approach, such as administering medications without a physician's order or deviating from established protocols without proper justification, violates regulatory guidelines regarding scope of practice and patient safety. This could lead to adverse drug reactions or ineffective treatment and constitutes a breach of professional conduct. A third incorrect approach, such as failing to document interventions, creates a gap in the patient's medical record, hindering effective communication among the healthcare team and potentially leading to errors in future care. It also represents a failure to comply with regulatory documentation requirements. Professional decision-making in such situations should involve a systematic process. 1. Rapidly assess the patient's vital signs and subjective complaints. 2. Identify the specific complication based on assessment findings. 3. Consult established protocols and guidelines for managing that specific complication. 4. Implement the prescribed interventions promptly and accurately. 5. Continuously monitor the patient's response to interventions. 6. Communicate any significant changes or concerns to the nephrologist or physician. 7. Document all assessments, interventions, and patient responses thoroughly and accurately. This structured approach ensures patient safety, regulatory compliance, and optimal treatment outcomes. Question 14. To address the challenge of a dialysis patient exhibiting signs of potential fluid overload during treatment, including increased shortness of breath and edema, which of the following represents the most appropriate immediate course of action for a certified dialysis technician? Option A. Attempt to administer a diuretic medication that is available in the unit without a specific physician's order for this patient. Option B. Immediately notify the registered nurse and / or physician of the patient's symptoms and continue to monitor the patient closely as per protocol. Option C. Continue the treatment as scheduled, assuming the symptoms are temporary and will resolve on their own. Option D. Independently adjust the ultrafiltration rate to remove more fluid, believing it will alleviate the symptoms. The correct answer is B. Immediately notify the registered nurse and / or physician of the patient's symptoms and continue to monitor the patient closely as per protocol. Explanation. This scenario presents a professional challenge due to the critical nature of dialysis treatment and the potential for patient harm if care deviates from established protocols. The technician must balance immediate patient needs with adherence to strict safety and regulatory guidelines. Careful judgment is required to ensure patient well-being while maintaining the integrity of the treatment process. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols, which are foundational to dialysis technician certification regulations. This involves a systematic, evidence-based response that involves immediate assessment, communication with the appropriate medical personnel, and meticulous documentation. This aligns with the ethical obligation to provide competent care and the regulatory requirement to follow physicians' orders and facility policies. An incorrect approach that involves independently altering medication dosages without explicit physician orders represents a significant regulatory and ethical failure. This bypasses the established chain of command and the physician's responsibility for prescribing treatment, potentially leading to adverse patient outcomes and violating regulations concerning medication administration and scope of practice for a dialysis technician. Another incorrect approach, such as delaying notification of the nursing staff or physician while attempting to resolve the issue independently, is also professionally unacceptable. This failure to communicate critical patient status changes promptly can lead to delayed or inappropriate interventions, directly impacting patient safety and violating protocols for emergency response and patient monitoring. It also demonstrates a lack of understanding of the collaborative nature of patient care in a dialysis setting. Finally, an approach that involves ignoring the observed deviation and continuing the treatment as scheduled is a severe ethical and regulatory breach. This demonstrates a disregard for patient safety and a failure to uphold the technician's responsibility to monitor the patient and report any anomalies. It directly contravenes the core principles of patient care and the regulatory mandate to ensure safe and effective treatment. The professional decision-making process for similar situations should involve a clear step-by-step approach. 1. Assess the situation immediately and thoroughly. 2. Identify any deviations from the prescribed treatment plan or patient's baseline. 3. Communicate any concerns or observed deviations promptly to the appropriate medical professional, e.g., registered nurse or physician. 4. Follow established facility protocols for managing such situations. 5. Document all observations, actions, and communications accurately. This framework ensures that patient safety remains paramount and that all actions are compliant with regulatory requirements and ethical standards. Question 15. Governance review demonstrates a pattern of intermittent, minor fluctuations in the dialysate conductivity readings on a specific model of dialysis machine during patient treatments. As a dialysis technician, what is the most appropriate initial step to address this observation while ensuring patient safety and regulatory compliance? Option A. Seek advice from a colleague who has experience with this machine model to understand their approach to similar readings. Option B. Immediately replace the dialysate conductivity sensor, assuming it is the source of the fluctuation. Option C. Consult the dialysis machine's operational manual to review the section on dialysate conductivity monitoring and troubleshooting procedures. Option D. Continue treatments as usual, documenting the fluctuations but taking no immediate action, as they are minor. The correct answer is C. Consult the dialysis machine's operational manual to review the section on dialysate conductivity monitoring and troubleshooting procedures. Explanation: scenario analysis. This scenario presents a challenge in ensuring patient safety and regulatory compliance during dialysis treatments. A governance review highlighting potential issues with dialysis machine functionality necessitates a proactive and informed response from the dialysis technician. The challenge lies in accurately identifying the root cause of the observed machine behavior and implementing the correct corrective action without compromising patient care or violating established protocols. Correct approach analysis. The correct approach involves a systematic and evidence-based response that prioritizes patient safety and adheres to regulatory guidelines for dialysis equipment. This includes consulting the machine's operational manual, which contains specific troubleshooting procedures and functional descriptions for each component. This manual is the primary, authoritative source for understanding the machine's intended operation and identifying deviations. Adhering to the manual ensures that any interventions are aligned with manufacturer specifications and regulatory requirements for equipment maintenance and operation, thereby upholding best professional practice. Incorrect approaches analysis. One incorrect approach involves immediately assuming a major component failure and attempting a complex repair without consulting the manual or seeking expert assistance. This is a regulatory failure as it bypasses established protocols for equipment maintenance and troubleshooting, potentially leading to further damage or incorrect repairs. Ethically, it risks patient safety by operating potentially malfunctioning equipment. Another incorrect approach is to ignore the observed anomaly, assuming it is minor or will resolve itself. This is a significant ethical and regulatory failure. Ethically, it breaches the duty of care to the patient by not addressing a potential risk. Regulationally, it violates guidelines that mandate reporting and addressing any equipment malfunctions that could impact patient treatment. A third incorrect approach is to rely solely on anecdotal advice from colleagues without verifying it against official documentation. While peer advice can be helpful, it is not a substitute for manufacturer-specified procedures. This approach risks regulatory noncompliance if the advice is inaccurate or outdated, and ethically it can lead to improper treatment if the advice is flawed. Professional reasoning. Professionals should approach such situations by first recognizing the potential impact on patient safety and regulatory compliance. The decision-making process should involve 1. Immediate observation and documentation of the anomaly. 2. Consulting authoritative resources, such as the dialysis machine's operational manual and facility protocols. 3. If necessary, escalating the issue to a supervisor or biomedical engineering department. 4. Implementing corrective actions only after understanding the cause and ensuring they align with approved procedures. This systematic approach ensures that decisions are informed, safe, and compliant. Question 16. The audit findings indicate a recurring issue with the initiation of hemodialysis, specifically concerning the setup and connection phase. Technicians are sometimes observed to deviate from the established protocol for patient identification and pretreatment checks. Which of the following actions, if consistently implemented by all technicians, would best address this audit finding and ensure patient safety according to standard dialysis care guidelines? Option A. Prioritize completing the priming of the extracorporeal circuit and ensuring the dialysate is at the correct temperature before verifying patient identity. Option B. Always perform a double check of the patient's identification band against their chart and verbally confirm the patient's full name and date of birth before initiating any part of the dialysis treatment, including connecting the dialyzer. Option C. Rely on the patient's verbal confirmation of their identity without cross-referencing with their identification band or chart. Option D. Focus on efficiently connecting the patient to the dialysis machine, assuming the patient has been correctly identified by nursing staff earlier in the day. The correct answer is B. Always perform a double check of the patient's identification band against their chart and verbally confirm the patient's full name and date of birth before initiating any part of the dialysis treatment, including connecting the dialyzer. Explanation. The scenario presents a common challenge in dialysis technician practice, ensuring patient safety and adherence to established protocols during the critical phase of hemodialysis initiation. The professional challenge lies in balancing the need for efficient patient care with the absolute requirement for meticulous setup and connection to prevent adverse events, such as infection, air embolism, or circuit malfunction. Careful judgment is required to identify and rectify deviations from standard operating procedures. The correct approach represents best professional practice because it directly addresses the identified audit finding by reinforcing the fundamental principles of aseptic technique and patient identification, which are paramount in preventing healthcare-associated infections and ensuring the correct patient receives the correct treatment. Adherence to these steps is mandated by regulatory bodies overseeing dialysis care, such as the Centers for Medicare and Medicaid Services, CMS, in the U.S., which emphasize patient safety and quality of care through strict guidelines and conditions of participation. The correct approach prioritizes patient well-being and aligns with the ethical obligation of the technician to provide competent and safe care. An incorrect approach that involves proceeding with the connection without confirming patient identity and dialysis prescription details represents a significant regulatory and ethical failure. This bypasses critical safety checks mandated by regulations designed to prevent medical errors and patient harm. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Another incorrect approach, such as rushing the priming process to save time, directly contravenes established protocols for ensuring the extracorporeal circuit is free of air and pyrogens, posing a serious risk of air embolism or infection, which are reportable adverse events under federal regulations. Failing to document the connection process accurately, as might occur if shortcuts are taken, also violates regulatory requirements for complete and accurate patient records, hindering continuity of care and potential investigations into adverse events. Professional decision-making in such situations should involve a systematic approach, First, thoroughly understanding the audit finding and its implications. Second, recalling and applying the specific institutional policies and procedures, which are designed to meet regulatory requirements. Third, prioritizing patient safety above all else, even if it means a slight delay. And fourth, communicating any concerns or deviations from protocol to the appropriate supervisor or clinical team. This ensures that all critical steps are performed correctly and documented, upholding both regulatory compliance and ethical standards. Question 17. Risk assessment procedures indicate that during a hemodialysis treatment, a dialysis technician accidentally drops a sterile, single-use dialyzer onto the floor before connecting it to the patient's vascular access. The dialyzer remains in its sterile packaging. What is the most appropriate immediate course of action? Option A. Wipe the exterior of the dialyzer packaging with an antiseptic wipe and proceed with the treatment. Option B. Place the dialyzer back in its original sterile packaging and set it aside for later use if needed. Option C. Discard the dialyzer according to biohazard waste protocols and obtain a new, sterile dialyzer for the patient's treatment. Option D. Continue with the treatment using the dropped dialyzer as the packaging appears intact. Correct answer is C. Discard the dialyzer according to biohazard waste protocols and obtain a new, sterile dialyzer for the patient's treatment. Explanation. This scenario is professionally challenging because it requires a dialysis technician to balance immediate patient care needs with strict adherence to infection control protocols, which are paramount in preventing the spread of bloodborne pathogens in a dialysis setting. The technician must make a rapid, informed decision that prioritizes patient safety and regulatory compliance. The correct approach represents best professional practice because it directly addresses the potential breach of standard precautions by initiating immediate containment and reporting. This aligns with the core principles of infection control mandated by regulatory bodies overseeing dialysis technician certifications, which emphasize preventing cross-contamination and ensuring a safe environment for all patients, promptly isolating the contaminated equipment and notifying the appropriate personnel, e.g., charge nurse, infection control specialist, allows for a thorough investigation, proper disinfection or disposal of the equipment, and reinforcement of protocols to prevent recurrence. This proactive stance is crucial for maintaining the integrity of the dialysis unit's safety program. An incorrect approach that involves simply cleaning the equipment without reporting or isolation fails to acknowledge the potential for transmission of infectious agents. This oversight represents a significant regulatory and ethical failure. Standard precautions are designed to prevent exposure to blood and body fluids, and a breach, even if seemingly minor, necessitates a formal response to assess risk and implement corrective actions. Failure to report could lead to undetected contamination, putting subsequent patients at risk and violating guidelines that mandate reporting of potential breaches. Another incorrect approach, such as continuing with the treatment using the potentially contaminated equipment after a brief wipe down, is a grave violation of standard precautions. This demonstrates a lack of understanding of the critical importance of preventing cross-contamination in dialysis. Ethically and regulatorily, this action puts patients at immediate risk of infection, which is unacceptable. It undermines the entire purpose of infection control measures and could have severe health consequences for patients. A professional reasoning process for similar situations involves a systematic approach. 1. Recognize the potential breach of standard precautions. 2. Immediately take steps to contain the contamination and prevent further exposure, e.g., isolate the equipment. 3. Report the incident to the appropriate supervisor or infection control personnel. 4. Follow established protocols for investigation, disinfection, or disposal. 5. Participate in any required retraining or review of procedures. This process ensures that patient safety is prioritized, regulatory requirements are met, and continuous improvement in infection control practices is fostered. Question 18. Consider a scenario where a patient undergoing hemodialysis reports a sudden onset of severe shortness of breath and chest tightness, accompanied by a rapid, thready pulse and a drop in blood pressure. The patient also appears restless and anxious. Option A. Immediately notify the registered nurse and physician, prepare for potential fluid overload or cardiac compromise, and monitor vital signs closely. Option B. Administer a prescribed diuretic to reduce fluid volume, as this is likely the cause of the symptoms. Option C. Reassure the patient that these symptoms are common during dialysis and continue with the treatment as scheduled. Option D. Advise the patient to take slow, deep breaths and suggest they may be experiencing anxiety unrelated to the dialysis treatment. The correct answer is A. Immediately notify the registered nurse and physician, prepare for potential fluid overload or cardiac compromise, and monitor vital signs closely. Explanation: scenario analysis. This scenario is professionally challenging because it requires a dialysis technician to differentiate between common, yet potentially serious, complications of renal failure and their management. The technician must rely on their understanding of physiological changes associated with end-stage renal disease and the immediate interventions appropriate for their scope of practice, while recognizing when to escalate care to a registered nurse or physician. The urgency of potential complications necessitates rapid and accurate assessment. Correct approach analysis. The correct approach involves recognizing the signs and symptoms of a specific complication of renal failure and initiating the appropriate, within the technician's scope of practice, immediate intervention. This aligns with regulatory frameworks for dialysis technicians, which mandate competency in recognizing and responding to common patient issues and emergencies. Best professional practice dictates prioritizing patient safety through prompt and accurate assessment and intervention, adhering to established protocols and the technician's defined role. This demonstrates an understanding of the physiological consequences of renal failure and the immediate needs of the patient. Incorrect approach is analysis, an approach that focuses solely on documenting symptoms without initiating any immediate action or reporting to a nurse or physician, fails to meet the ethical and regulatory obligation to ensure patient well-being. This inaction could lead to a delay in critical care, potentially exacerbating the complication and violating patient safety standards. An approach that attempts to diagnose and prescribe treatment beyond the technician's scope of practice is a direct violation of regulatory guidelines. Dialysis technicians are not authorized to make medical diagnoses or prescribe medications. Such actions constitute practicing medicine without a license and pose significant risks to patient safety. An approach that dismisses the patient's reported symptoms as insignificant or unrelated to renal failure without further investigation or assessment is negligent. Renal failure can manifest in numerous ways, and a competent technician must consider all reported symptoms in the context of the patient's condition and escalate concerns appropriately. This failure to assess and report could lead to misdiagnoses and delayed treatment. Professional reasoning. Professionals should employ a systematic approach. 1. Assess the patient's reported symptoms and vital signs. 2. Correlate these findings with known complications of renal failure. 3. Determine the appropriate immediate action within the scope of practice, which may include specific interventions or immediate notification of a registered nurse or physician. 4. Document all assessments, interventions, and communications accurately. This decision-making process ensures patient safety, adherence to regulatory requirements, and ethical practice. Question 19. The investigation demonstrates that a dialysis technician, while performing routine pre-treatment checks on a dialysis machine, notices a subtle but persistent fluctuation in the transmembrane pressure reading that deviates slightly from the machine's normal operating parameters. The technician has experienced similar minor fluctuations before with this specific machine, which resolved on their own after a few minutes, and they are concerned that reporting it might lead to the machine being taken out of service for an extended period, delaying treatments for scheduled patients, and potentially causing them personal inconvenience due to reassignment. What is the most appropriate course of action for the dialysis technician in this situation? Option A. Attempt to recalibrate the machine's pressure sensor themselves, based on past experience, to see if the fluctuation can be corrected without involving other departments. Option B. Continue with the patient's treatment as scheduled, assuming the fluctuation is minor and will resolve itself, and make a note to monitor it more closely during the treatment. Option C. Document the fluctuation in the machine's logbook and immediately report it to the biomedical engineering department or supervisor for assessment and potential repair, even if it means delaying or rescheduling patient treatments. Option D. Inform the patient about the slight equipment anomaly and ask if they are comfortable proceeding with the treatment, explaining that it might cause a slight delay. The correct answer is C. Document the fluctuation in the machine's logbook and immediately report it to the biomedical engineering department or supervisor for assessment and potential repair, even if it means delaying or rescheduling patient treatments. Explanation: this scenario presents a professional challenge because it involves a potential compromise of patient safety due to equipment malfunction and a technician's personal bias influencing their reporting. The technician is faced with a conflict between their duty to report a safety concern and their desire to avoid personal inconvenience or perceived repercussions. Careful judgment is required to prioritize patient well-being over personal comfort or potential negative outcomes for themselves. The correct approach represents best professional practice because it directly addresses the potential harm to patients and upholds the integrity of the dialysis process. Reporting the equipment anomaly, even if it seems minor or inconvenient, aligns with the core ethical and regulatory responsibilities of a dialysis technician. This ensures that the equipment is inspected and repaired, preventing potential adverse events for current and future patients. Adherence to established protocols for equipment maintenance and reporting is paramount and is typically mandated by regulatory bodies overseeing dialysis facilities. An incorrect approach that involves ignoring the anomaly or downplaying its significance is a direct violation of patient safety protocols. This failure to report a potential equipment malfunction could lead to serious patient harm, such as inadequate dialysis treatment, fluid overload, or electrolyte imbalances, all of which can have life-threatening consequences. Such an action would contravene regulations that mandate the reporting of all equipment issues and could result in disciplinary action, including loss of certification. Another incorrect approach, such as attempting to fix the issue without proper authorization or documentation, is also professionally unacceptable. This bypasses established safety checks and balances, potentially masking the problem or creating new ones. It undermines the quality assurance processes designed to ensure equipment reliability and patient safety, and it violates guidelines that require all maintenance and repairs to be performed by qualified personnel and properly documented. The professional reasoning process in such a situation should involve a clear hierarchy of priorities. Patient safety first, followed by adherence to regulatory requirements and facility protocols. The technician should first assess the immediate risk to the patient undergoing treatment. If there is any doubt about the equipment's safety or efficacy, treatment should be paused or modified according to established emergency procedures. Regardless of the immediate risk, the technician must then follow the facility's established protocol for reporting equipment malfunctions. This typically involves documenting the issue, notifying a supervisor or biomedical engineering department, and ensuring the equipment is taken out of service until it is deemed safe. If the technician is unsure about the protocol, they should seek clarification from their supervisor immediately. Question 20. Upon reviewing the dialysis machines monitored during a hemodialysis treatment, a technician observes a slight, intermittent fluctuation in the displayed blood flow rate, which is slightly below the prescribed target. Concurrently, the dialysate flow rate appears stable and within its normal range. The patient reports feeling generally comfortable with no immediate complaints of pain or discomfort. What is the most appropriate course of action for the dialysis technician in this situation? Option A. Focus solely on ensuring the dialysate flow remains within its normal range, as the blood flow fluctuation is a minor deviation. Option B. Adjust the blood pump speed slightly to bring the blood flow rate back to the prescribed target without consulting the nephrologist. Option C. Continue monitoring the treatment, assuming the slight fluctuation in blood flow is within an acceptable margin of error and not clinically significant given the patient's comfort. Option D. Immediately notify the nephrologist of the observed blood flow fluctuation and the stable dialysate flow, and await further instructions. The correct answer is D. Immediately notify the nephrologist of the observed blood flow fluctuation and the stable dialysate flow, and await further instructions. Explanation: this scenario is professionally challenging because it requires the dialysis technician to interpret subtle physiological cues and machine readings in real time, balancing patient comfort with the critical need for effective treatment. The technician must exercise sound clinical judgment to differentiate between normal variations and potential complications, all while adhering to strict protocols. The correct approach represents best professional practice because it prioritizes patient safety and treatment efficacy by directly addressing the observed discrepancy, promptly and accurately assessing the blood flow rate and dialysate flow, and then communicating these findings to the nephrologist aligns with the core responsibilities of a dialysis technician, as outlined by regulatory bodies governing dialysis care. This proactive stance ensures that any deviation from the prescribed treatment parameters is identified and rectified swiftly, preventing potential adverse events and ensuring the patient receives the intended therapeutic benefit. Adherence to established protocols for monitoring and reporting is a fundamental ethical and regulatory requirement. An incorrect approach that involves ignoring the slight fluctuation in blood flow rate and assuming it is within acceptable limits is professionally unacceptable. This failure to investigate a potential deviation from prescribed parameters constitutes a breach of the technician's duty of care. Regulatory guidelines mandate vigilant monitoring and prompt reporting of any changes that could impact patient safety or treatment effectiveness. Similarly, an approach that focuses solely on the dialysate flow without considering the concurrent blood flow fluctuation overlooks the interconnectedness of these parameters in dialysis. Both blood and dialysate flow rates are critical for adequate waste removal and fluid balance, and a discrepancy in one may indicate an issue with the other or a separate problem altogether. Failing to investigate both aspects demonstrates a lack of comprehensive understanding and adherence to best practices in patient monitoring. Another incorrect approach, such as adjusting the blood flow rate without physician consultation, is a severe regulatory and ethical violation. Dialysis technicians are not authorized to unilaterally alter prescribed treatment parameters. Such decisions must be made by a qualified physician. This action bypasses essential safety checks and could lead to patient harm. Professional decision-making in such situations involves a systematic process. First, observe and document all relevant data, machine readings, patient's condition. Second, compare these observations against established protocols and prescribed treatment parameters. Third, identify any deviations or potential issues. Fourth, assess the urgency and potential impact of the deviation. Fifth, communicate findings clearly and concisely to the appropriate healthcare professional, in this case, the nephrologist. Finally, follow the physician's orders for corrective action and continue to monitor the patient and treatment.